Hello, everyone, and thank you so much for coming here today. My name is Aurora Grant Wingate, and I am the Member and Partner Engagement Associate at the National Association of Community Health Workers, or NACHW. Para la escucha la presentación en español, haga clic en este icono en la parte inferior de su pantalla. Thank you so much for being here today. And we also want to give a big thank you to Unidos and the CDC for being so wonderful in helping us put together this webinar, town hall for community health workers on the monkeypox virus and what folks need to know to respond and help communities. We know throughout this pandemic that monkeypox has not reached all communities equitably, and we believe getting this information into the hands of community health workers is an essential part in helping to address that inequity. We have some changes in the lineup today for speakers. Dr. Mena, unfortunately, is not able to join us today, but we are very lucky to have Dr. Bryce or Bruce Furness here with us today, who is the medical epidemiologist with the CDC DST-DP, who has been embedded within the Washington, D.C. DOH since 2002. He has acted in many different capacities as the acting chief division of STD control, as the chief medical officer, Southeast STD, and tuberculosis control and chest clinics, and currently as the strategic information division STD medical epidemiologist. We really appreciate, Bruce, you being here with us today and filling in, and we look forward to your presentation. One last note before we jump into this introductory presentation to monkeypox. If folks have questions throughout the presentation, please feel free to throw them in our Q&A or chat them in the chat box. We look forward to this presentation, and Bruce, I will hand it over to you. Thank you.
Thank you, Aurora. I am going to share my screen. Okay, are you seeing the presentation in presentation mode?
Yes.
Okay. Okay, so as Aurora said, my name is Bryce. I am with the Division of STD Prevention. I work with Dr. Mena, and he is very, very sorry he can't be here today. If there were any way he could be here, he would. He looks forward to these type of listening sessions and outreach. So I am here today to talk about monkeypox 101, if you will. And I'm going to talk about monkeypox in general, some basics. I'm going to talk about what CDC is doing to reduce stigma and how you can help. And then hopefully we'll be able to have a robust Q&A session and discussion, and then a wrap up. By now, many of you have already heard probably that about monkeypox, but I wanted to provide a brief overview. Monkeypox is a rare disease caused by infection with a monkeypox virus. While monkeypox virus is related to the virus that causes smallpox, the illness caused by monkeypox virus is less severe than monkeypox. And that's not to say that there aren't severe monkeypox disease going on outside endemic countries right now, but it does tend to be less severe than smallpox. Prior to the current global outbreak, monkeypox had been reported in people in several Central and Western African countries, or people who had traveled to these endemic areas, or been in contact with animals from those countries. In 2003, there was an outbreak here in the United States of America that was associated with prairie dogs that were somehow came in contact with other animals that were being imported from Ghana. However, for the first time in history, in the current global outbreak, monkeypox virus has spread widely through person-to-person contact. Now I'll cover some details on the current outbreak. As of October 25th, 27,884 cases have been identified in the United States. While many of those affected in the current global outbreak are gay, bisexual, or other men who have sex with men, not all cases fall into these categories, and anyone can catch monkeypox if they have close contact with someone who has monkeypox, regardless of gender identity or sexual orientation. The type of monkeypox seen in this outbreak is rarely deadly, but some people have higher risk for severe illness, and severe cases so far in this outbreak have mostly been seen in people with monkeypox who are also immunocompromised. I think on the incident management talk this morning, they talked about 6 deaths in our country, that can be associated with the monkeypox virus. This graph shows case numbers over time in the United States since the start of the outbreak. The first case in the United States of America was, I believe, May 17th, and that's where this starts. And it goes through October 17th, I think, is the last day on this graph. You can see cases started in May on the left side and peaked throughout the month of August and have started to decline within the last month on the right side of the graph. This is good news for those of us who have been involved since the beginning. This map of the United States is color-coded by number of cases per state, with darker shades representing a higher number of cases. The highest reporting states, or the states reporting the greatest number of cases, are California, New York, Florida, and Texas. States with the darkest shade of blue have over 500 reported cases, whereas states that are white have 1 to 10 cases. And I will say that the last state that reported a case was Wyoming. This graph shows the number of cases by age and gender. From left to right, the bars represent younger to older people with monkeypox. For reference, the age group with the most cases is shown in the tallest bar in the center, which represents cases aged 31 to 35 years of age. These bars are also color-coded for gender percentages. The navy blue color represents patients who identify as male, and you can see this accounts for most cases in this outbreak. But there have been cases among women, transgender men, transgender women, and also others that consider themselves another sex or gender. This graph shows the percent of monkeypox cases in the United States by race and ethnicity, which is color-coded using the legend on the right side of your screen, actually the left side of your screen, sorry. From left to right, the bars show how the race and ethnicity of monkeypox cases have changed over time from the start of the outbreak in May on the left side through September on the right side. As you can see, in the beginning of the outbreak, the cases reported as white made up the highest percent of cases, whereas over the course of the outbreak, we began to see an increase in the proportion of cases reported who are Hispanic or Latino or Black or African American. Over the last couple of months, the trend has now shifted so that the majority of cases are reported among Black or African American individuals. As you can imagine, this is raising a lot of stigma-related concerns. So I'm going to quickly review the symptoms of monkeypox during this outbreak and how they have been somewhat different from what was seen previously. The rash for monkeypox in this outbreak can be described in several ways. In the terms of numbers, the rash with monkeypox can be anywhere from 1 single skin lesion to several lesions, or too many to count. And the rash can be located only on one part of the body, or it could be present on several parts of the body. As for location, the rash can appear on any skin surface and can also be inside the body, including the mucous membranes of the mouth, the vagina, or the anus. In terms of appearance, the rash might look like bumps that are firm or may feel rubbery, and they sometimes have a central dent. These same bumps usually change in appearance during the course of illness and can also look like pimples or blisters before they eventually scab and fall off. For some people, the rash is itchy. Some people don't feel anything. For others, it can be extremely painful. The rash can be very small and can be confused with other infections like sexually transmitted infections and chickenpox. Monkeypox usually presents with symptoms similar to the flu, followed by a rash. And we typically call those symptoms that precede the rash as the prodromal syndrome. Because some of the flu-like symptoms sometimes experienced with monkeypox can be confused for symptoms of COVID-19 or other respiratory infections, it makes it confusing as to whether or not folks are having symptoms consistent with monkeypox or with something else. It is important for people who are sick to avoid close contact with others, stay home, and to seek medical care as appropriate. Although many people with monkeypox have flu-like symptoms before the rash, during this outbreak, some people develop a rash first before the other symptoms, and some people only ever have a rash. In terms of timeliness of symptoms, the symptoms usually start within 3 weeks of exposure to the virus, and the illness typically lasts 2 to 4 weeks. If someone does have flu-like symptoms, they usually will develop a rash 1 to 4 days later. Fortunately, the type of monkeypox seen in this outbreak is rarely deadly, and more than 99% of people who get this form of the disease are likely to survive. It should also be noted that some people have higher risk for severe illness, including children under 8, people who have weakened immune systems or are pregnant, and people with a history of eczema or other serious skin conditions. Cases that are not life-threatening can still be painful and can be severe. Next, I'll talk about the transmission of the monkeypox virus. Monkeypox can spread to anyone through close personal skin-to-skin contact. And during this outbreak, most all cases are reported through this type of transmission. This type of transmission includes direct contact with rash or scabs, contact with objects, fabrics, and surfaces that have been used by somebody with monkeypox. And this is especially important for community healthcare workers who might have to deal with sheets, clothing, towels from somebody who has monkeypox. Also, contact with respiratory secretions during prolonged face-to-face contact. This is different than what we see with COVID-19, which is spread through respiratory aerosols and can be considered somewhat airborne. These are large respiratory secretions. Think of saliva, think of spittle. Other intimate contact can also include oral, anal, and vaginal sex, or touching the genitals or anus of a person with monkeypox, hugging, massaging, or kissing, again, skin-to-skin contact, or touching things that were used by a person with monkeypox. As mentioned, this can include bedding towels or sex toys. In the past, monkeypox has also been transmitted during pregnancy through the placenta. Historically, outbreaks of monkeypox have been associated with infected animals. Since monkeypox can spread between people and other animals, especially mammals, people with monkeypox should stay away from pets or other animals. There is a documented case out of France that was published in the Lancet not long ago that showed that a man with monkeypox spread the disease to his dog, who also had symptoms and was sick. We don't know whether that dog could infect another person, but we do know that this particular monkeypox virus can be spread from owners to their canines. So how long can someone transmit monkeypox virus? It's a good question. The virus can be spread from the time symptoms start until the rash is healed. All scabs have fallen off and a fresh new layer of skin has formed. And again, I'm going to say that again. It can be transmitted from the time the first symptoms start, not the rash, but the first symptoms. So if a person has fever or muscle aches or is feeling tired 3 or 4 days before their rash appears and they have monkeypox, they're actually infectious from the time those symptoms start, not when the rash starts. Scientists are still researching if the virus can be spread when someone has no symptoms. How often monkeypox might be spread through respiratory droplets. So in other words, how often the secretions, the spittle, the saliva can spread the disease, and whether or not monkeypox can be spread through other body fluids like ejaculate, pre-ejaculate, and vaginal fluids. In order to prevent the spread of monkeypox, people with monkeypox should avoid close contact with others. We being CDC, recommend not leaving your home for work and to telework if possible. If someone with monkeypox is around other people, such as for seeking medical care, they should wear a well-fitting mask and cover the rash. Don't share items you have touched with others, and ask your healthcare provider if you are not sure whether you can spread monkeypox to others. They can provide the best guidance depending on what symptoms you have and where those symptoms are located. In order to protect yourself from monkeypox, avoid close skin-to-skin contact with people with monkeypox, avoid contact with items used by someone with monkeypox, and wash your hands frequently. Lastly, get vaccinated if you are at high risk for being exposed or if you were exposed. Monkeypox vaccination. Monkeypox vaccination is recommended for anyone with a known exposure to someone with monkeypox or for people who are at increased risk for being exposed. People at increased risk for exposure are listed on the slide. And I'm sorry, that slide happens to not be here. So there are two vaccines. So the types of exposure are more than 2 sex partners in a 2-week period. If you go to sex venues to have sex, if you have multiple partners, especially if those partners are anonymous, or if you engage in group sex, or have 3 or more partners at the same time while engaging in sex. Those are some of the risk factors that are associated with people self-identifying as being high risk and seeking out vaccination to protect themselves. There are 2 vaccines that can be used to protect against monkeypox, JYNNEOS and the ACAM 2000. But JYNNEOS has been the vaccine most frequently used during this outbreak. Although JYNNEOS requires 2 doses, it has a lower risk of serious side effects compared to ACAM 2000. People can contact their healthcare provider or local health department to ask about vaccine eligibility and access. The Vaccine Equity Pilot Program is currently making monkeypox vaccines available to health departments and other organizations who provide populations that may face barriers getting monkeypox vaccination. And the website to that Vaccine Equity Pilot is at the bottom. Next, I'm going to quickly cover monkeypox testing and treatment. Currently, testing is only recommended if someone has a rash consistent with monkeypox. Those bumps or those sores or those rashes need to be swabbed and sent to the lab. Only a healthcare provider, including some public health departments, can order a monkeypox test. Most people with monkeypox recover fully within 2 to 4 weeks without the need of treatment. But because monkeypox and smallpox viruses are closely related, there are drugs and vaccines developed to protect against smallpox, which may be used to prevent and treat monkeypox virus infections. Scientists are still researching to understand how effective these treatments and vaccinations are for monkeypox. To learn more about treatment options, please consult your healthcare provider. To reduce stigma, CDC is being transparent with the data we have on diagnosis of monkeypox cases, what we know about transmission in the current outbreak, who is experiencing severe disease requiring treatment, who is accessing vaccines, and where we are seeing disparities, as well as how we are attempting to address those disparities. So there are graphs and data for all of that on CDC's website, accessible to the public. By following the data and reaching populations with honest, non-judgmental, and non-alarmist communication as quickly as possible, we can minimize stigma. Stigma occurs when we associate the disease with a group of people, regardless of whether individual members have the disease or not. Men who reported sexual contact with another man were the dominant group of people being diagnosed. Yet a growing proportion of the outbreak, see the yellow, gray, and burnt orange in the bar graph, is increasing over time. And these proportions of the table tell us that monkeypox isn't just occurring among gay, bisexual, and other men who have sex with men, and that sexual contact isn't the only means of acquiring the disease. Here in Washington, DC, at the DC Health and Wellness Center, we have diagnosed monkeypox disease in this outbreak among a 6-month-old and among a female. However, this fact did not prevent media and the public from stigmatizing monkeypox or the most affected population, gay, bisexual, and other men who have sex with men, circled in red. CDC is focusing our messages on the facts. We are trying to allow the affected or impacted subpopulations know they are at risk without giving any information to the public that can be used for stigmatization. The fact is anyone can get monkeypox, though in the present outbreak, gay, bisexual, and other men who have sex with men are the most affected population. Also, we are encouraging those who are most likely to acquire monkeypox to consider modifying their behaviors in which skin-to-skin contact or extensive respiratory secretions, such as saliva and spittle, are exchanged. We are working directly with communities to ensure they have access to the latest science and data so that they are aware of what is happening. In addition, we are monitoring the data both domestically as well as internationally and making any adjustments to our approach and messaging in a non-judgmental or stigmatizing language based on what the science is telling us. CDC is working with healthcare workers, laboratory staff, and medical providers to ensure they have the latest information as quickly as possible so they can offer their patients the most appropriate treatments based on the patient's symptom, severity of disease, and to protect themselves and those they interact with. CDC, the White House, and other federal partners have conducted listening sessions with the public, including specific listening sessions with networks of affected populations, such as organizations that address HIV. As we hear concerns, such as fear of getting vaccinated due to the stigma associated with the current monkeypox outbreak, we are addressing those concerns by modifying our approach. We are also focusing resources and information on those affected, especially those most affected. The multinational monkeypox response is being informed from what public health and the CDC has learned from HIV, as well as our work to address continued increases in other sexually transmitted infections. For instance, we are avoiding stigmatizing terms. A number of CDC staff who typically work with affected populations, including gay, bisexual, and other men who have sex with men, as well as experts in HIV and STI prevention, are staffing the response. I am one of those individuals. I have been in the Division of STD Prevention since 2002. I've been embedded in the Department of Health here in Washington, DC since 2002, and I am an LGBTQ+ health expert, subject matter expert, and I was pulled into this response from the get-go, from the very first case we had in the United States in May. We are working on the monkeypox response because we have learned a thing or two about how to reach populations with non-judgment and respect. How can you help? Seek information from trusted sources. We hope that CDC's web pages and news releases are part of your trusted sources. We encourage you to go to your local and state Department of Health's website to get the latest information on what is happening in your area regarding monkeypox. And this can vary significantly from program area, even from state to state. Again, anyone can get monkeypox. Educate yourself about the signs and symptoms, and if you think someone you love may have been exposed, encourage them to seek medical care. Be supportive and do not judge them. Offer support and care in a manner that is respectful and protective of you and them. I am done talking. I'm going to open it up to Q&A, and I'm going to leave this up right here because this has the information on it if you need more information. Thank you.
Thank you so much, Dr. Furness. I don't think we have gotten a lot of questions right now, so I think we're going to save Q&A till the end of the presentation. But as a reminder, folks, please feel free to drop your questions in the chat and in the Q&A box, and we should have some time at the end of the presentation to answer those. Now, I am very pleased that we are going to have some folks who are doing monkeypox outreach on the ground come and share their experience. I am very pleased to introduce Kimberly Sharamonte, the Senior Project Manager for the Vaccine Ambassador Program at the National Healthcare for the Homeless Coalition. Kimberly, please come on the mic and I will share your slide and tell us all about your organization.
Thank you so much, everyone, and thank you, Aurora. Again, I'm Kim. I'm with the National Healthcare for the Homeless Council, and I work on our Vaccine Ambassador Project. The Council is the National Technical and Training Assistance Partner funded through HRSA, Health Resources Service Administration. However, the Vaccine Ambassador Project is funded by the CDC and collaborated through the National Association of Community Health Centers, NACHW. So overall, In the fall of 2021, we awarded 15 organizations throughout the country that included urban areas like Los Angeles and less densely populated communities like Jeffersonville, Indiana. We really tried to spread out across the country. And the purpose initially was to increase COVID-19 vaccinations among 3 populations: those experiencing homelessness, those with substance use disorder, and those who engage in sex work, with the goal of reducing COVID-19 vaccine hesitancy. And that strategy and how we are going to do that was we are going to improve COVID-19 immunizations by implementing COVID-19 vaccine ambassadors, community health workers, or peer navigators to reach those identified that are at an increased risk of severe illness from COVID-19, and to reach those that might have been lost to care. And the deliverables that we are hoping to achieve and have surpassed was to hire and train our workforce. We have over 32 ambassadors, provide outreach and engagement. We've had over 35,000 encounters with folks on the ground, but we know that's much undercounted because to mark every single person we say hello to out in the field isn't necessarily easy. And then we've vaccinated over 30,000 individuals in the community. There have been so many valuable takeaways from this project, but one of the most crucial has been the role of community health workers being those key figures, influencers, stakeholders in their communities. While we began talking about this project, it was before COVID vaccines were being pushed in the community. We are finishing year 1 with COVID vaccines and a CHW response to public health crises, including monkeypox. Going to pass this off to the amazing folks at Wesley Health Center's JWCH Institute. Jill Lubin is a program director leading their ambassador workforce, including Christopher Mack, a senior community outreach specialist. And I'm going to pass it over to you guys.
I think I'm here.
Yeah.
So,
Good afternoon. Hi.
good afternoon.
Thank you so much, Kimberly. We really appreciate the introduction and all the work that we've done with you over the last year. Christopher's here with me. I'll introduce him in a minute, but I'm going to give you a little bit of information about JWCH Wesley Health Centers. We're here in our main clinic, Center for Community Health, which is in the downtown Skid Row area of Los Angeles, which is a very densely populated area of both service providers and individuals who are people who are experiencing homelessness. However, very active members of the community, artists and poets and singers, and thriving here in the community, but often do need help. And that's where we are, a safety net. We're a federally qualified health center. We see about 200 individuals every day coming through our clinic. We'll have some resources to share, a flyer of our clinic with all of the services that we provide: primary care, behavioral health, dental, optometry, podiatry. And in the last year, we brought on a chiropractor, which has been a very welcomed service here, especially for folks that are standing, many, many hours a day, having chronic back pain or leg pain from sleeping on the sidewalk. So I wanted to talk a little bit about the work that the community health workers are doing. But before I do that, I do want to just mention the way that we became first involved with monkeypox vaccines and information sharing was when the county contacted us to provide monkeypox vaccines at the commercial sex venues or bathhouses here in the LA area. There are several that are still open, although several have also closed since the pandemic. So some of our more busy bathhouses or commercial sex venues owners reached out through the county to have vaccines done on site. So we brought our mobile unit there, and over the course of 4 events, vaccinated over 500 individuals. So that was sort of our beginning. And then we segued to make sure that our vaccine ambassadors and all of our community outreach workers had the information and resources and tools to provide to our community members. And we started offering both testing and vaccination in our clinic every day, either to individuals that our team outreach to and brought in, or in reach to and brought over to the provider if they were interested in testing while they were in the clinic for a visit. So I think I'll pass it on to Christopher, but again, we're here in Los Angeles. Greetings from LA. Nice sunny weather. Sorry if it's snowing other places, but we don't really see the seasons like you guys do. But greetings from Los Angeles, and I'll introduce Christopher Mack, who I've had the pleasure of working with for close to 20 years here in the downtown Skid Row area of Los Angeles.
Yeah. So let me take this off for a moment. Good afternoon. So wonderful to see you again, Kimberly. And yes, I really enjoyed the vaccination ambassador program. And I applaud, the CDC for being able to put people out on the street and to have those encounters. And yes, the engagement is one number, but the encounter is far greater than that. So when we do deal with people, we have an encounter, and then we have people who may not be interested in that day. And then we have the engagement, and then those are the people that we try to get to sustain in using the healthcare system so that we can move from crisis healthcare to maintenance healthcare. And Wesley has been a great opportunity for me to get people connected with healthcare, because it's life-changing, it's life-saving. Though people are in a condition, they're still persons. And we're talking about reducing the stigma. Is we cannot treat people according to the condition, we have to treat people according to their humanity. And so one of the things was to move from the vaccine ambassador program to also giving information about monkeypox, because what the messaging was first announced about monkeypox was it was a gay disease. And that type of messaging always impacts the people. Because now you have an uphill climb, because you have to convince people that everybody is at risk. And so one of the things about the vaccine ambassador program, it gave us that connection to people so that we became a trusted source in things that would come down the line. So it was natural to move from the COVID vaccine program into giving information, disseminating the correct information about monkeypox. The best way to work with monkeypox, and I got to do this first. When people see homelessness, there's various degrees of what homelessness looks like, especially in LA, in the Skid Row area. You have the people on the ground in tents, you have the people who are in the shelters with the service providers, and you have the people who are in residence, going through transitional housing or permanent housing. So there's three variations, and there's three different types of people you have to deal with. Now, the people on the street, you really want to educate them to, the close skin contact, the people that are in the shelters. You also want to inform them about skin-to-skin contact. And that's where the message really was able to be changed, is when you have people coming from the shelters to say, I want to look and see if I have monkeypox. And then we could then send them to the appropriate area. But the people who lived in housing, they said, well, that's not me. I'm not gay, so I'm not interested. Or you had somebody who found themselves with a rash, and they'd come and say, oh, I have this rash. Could it be monkeypox? And you say, well, here, we can send you to a nurse to examine it and to help. So when I was doing the work of canvassing, first of all, the first thing was to dispel the message so that everybody could be included and people would not be stigmatized. The second is to be able to deal with and deliver it to the whole geographic area of Skid Row. And because Skid Row is its own ecosystem. And so we have to, but at the front of it, I think dealing with people like they're human beings, and that they're humanity, and that they're precious, and that their life matters, gets a different way to give a message. So, do that one.
Yeah.
Okay.
Yeah, so just to add a little bit to that, but again, I think, the outreach workers are boots on the ground. They're the individuals, they're sort of the first point of contact for folks that may have either been a patient of ours, but have fallen out of care. We saw a lot of that during the pandemic when people weren't coming in for just routine care or maintenance. They may be sent out, to locate someone who has an abnormal lab value. But in any of the efforts that they're doing as outreach workers, always the messaging is looking at the different, whatever's going on at that day and time. So whether it's continuing our work around COVID vaccinations, of course, monkeypox vaccines, whatever is going on, we're doing regular TB testing. We've seen a little bit of uptick in TB here in LA County. So whatever is whatever they need to do to get the message out and be that point of contact, develop that rapport, develop those relationships, meet people where they're at. Of course, that's going to make it an easier transition. And it may be one contact, it might be 10 contacts. Chris, did you have any anecdotal story you wanted to share?
Well, yeah, I had a guy, he was staying in the shelter at the Weingart, and so he found himself with a rash, and so he came into the clinic. And so I was telling him, I was telling him about monkeypox. This is the inReach. I was telling him about monkeypox, and he said, "Oh, I have this rash," and he was worried, he was concerned, I might have monkeypox. And so since we had a monkeypox vaccine clinic in the clinic at that time in operation, I was able to bring the guy directly to the nurses, where they informed him and gave him further information about monkeypox. And so he was able to walk away knowing that he didn't have monkeypox, but also he was able to take the vaccination. So those are the kind of things that, as long as we're available and present to people so that we can give them the information, then they can make the consent for themselves.
I think that covers our piece. If there's any questions, of course, we'll be happy to address them.
Thank you so much, Jill and Christopher. This is a last minute invite and you guys were absolutely incredible. And thank you so much for the work that you are doing on the ground. I'd love to invite you guys to stay on screen for our Q&A portion now, along with our other subject matter experts who have been speaking. Thank you so much for already starting to answer questions in the Q&A. One thing that seems to be a question folks are asking is really if someone's apprehensive around getting the vaccine or they're worried about the stigma that might be around it, how do you start that conversation?
Well, first of all, sometimes a person is coming in for something entirely different. And so the way you do that is you address what it is the person is bringing to you. Once you do that, you start to form a relationship with that person right there on the spot. And so he will start to lead you into his necessities and what he needs. And at the same time, while you're talking to him, you can ask him, have you considered this? And if they say, oh, no, that's a gay disease, you can redirect it and say, well, no, well, when you have a little kid on the playground, he's not involved in any sexual contact, but yet little children were getting monkeypox. And so you take them back to some of the data that was out there that didn't just say gay. And so that's how you do that.
Thank you, Christopher. Dr. Furness, I also see you typing an answer if you want to come off mute and share that as well.
Yeah, thanks, Aurora. I just sent a response, but I think that that's part of what the vaccine health equity program that CDC is involved in is really trying to do, is it's trying to get vaccines to the community-based organizations that serve those that are most impacted, so that those individuals, if they are hesitant for these vaccinations or hesitant to go to a clinic or an organization they're not familiar with, they may be more comfortable getting vaccinated within the context of that organization that they already engage with and they already trust. And I mentioned it in the presentation, but I put the link in the answer that I just gave to that question. But that's really what that's trying to do, is trying to address some of what we're learning about the vaccine hesitancy out there in some of the most impacted populations.
Thank you. I know another question that's come in over the Q&A asks are there treatments available for monkeypox, and if so, how effective are they?
That's another very good question. So there are treatments for smallpox that are being used for monkeypox and seem to be fairly effective. The medicine is called tecovirimat, also the abbreviation is TPOXX, TPOXX, all in capital letters. So you may hear about TPOXX or you may hear about tecovirimat. We've had a lot of experience with this in the DC Health and Wellness Center. We don't use it for everybody. We use it for folks who have severe disease. And one of the criteria for severe disease is having an outbreak or a rash or lesions on the mucosal areas like the penis, like the butt, and like the mouth. So there is a treatment. It's not specifically for monkeypox, but we are using it for monkeypox. And it has been used to help ameliorate some of these really serious infections. There are other things like for the serious infection, there's IVIG that can be used. And there's a couple other antivirals that are used in really serious hospitalized infections when there are no other options. So hopefully that answers your question. There are treatments. The one that we're using most often for severe cases is TPOXX or tecovirimat.
And I couldn't sum up, I chickened out, like I don't know, I got scared. It's not that I didn't get scared, it's just.
Judy, you're not on mute.
Opening to talk to him about like.
Uh-oh.
Thank you. Another question we have in the chat, I think this might be for Christopher and Jill, is they're saying they have CHWs or other volunteers who really need this knowledge. What are ways that they can help and support them as they do this work?
Yeah,
That's what the
absolutely.
CHW.
Yeah, what I was going to mention too, and this might also be helpful, is certainly, rely upon your local county health department. We have a very close relationship with the Department of Health Services here in LA County. And we have an amazing LCSW who works as part of the Housing for Health program that we have on speed dial, and she has us on speed dial. So the county's been doing some pop-ups. They did a lot of work in vaccine and COVID vaccine, of course, but doing pop-ups for monkeypox, where our community, outreach workers will join their team to refer people to the pop-up. So it's not a territorial thing. It's just meeting people where they're at. So they may be at the Refresh Spot, which is a shower, bathroom, and laundry facility open 24/7, doing a pop-up, and then the community outreach workers will kind of work hand in hand and help bring people in for vaccination there. But I think utilizing your county Department of Health Services or public health department is really helpful in terms of local, resources, of course. And then the National Healthcare for the Homeless Council, of course, CDC, kind of reaching out, for up-to-date information. And then the National Association of Community Health Workers, I'm sure, in terms of some of the strategies that you offer, that to your constituents or your group would be really helpful.
Can I say one thing?
Mhm.
And sometimes you have to condense the information into one sheet, because a lot of times people are in a hurry. They want to go, they want to get away. And so sometimes when you have a lot of information and you're giving it to people, they become antsy, they become annoyed, and then you've lost it. So if you can condense the information and really sometimes all you do is just stick to some of the points, like the doctor was saying, to avoid the stigma, to really hit that home, then you get the person's attention better. And the quicker you're in, the faster you give him the information, the better you are. But you always leave the door open for him to come back to you for further information.
Thank you, Jill and Christopher. I see another question. Dr. Furness, I believe you're probably answering this right now, but someone asked, should everyone get vaccinated for monkeypox?
Thanks, Aurora. I put an answer there as well, but the short of it is no, not in this outbreak as it's currently evolving. I think that those at highest risk should probably get vaccinated, and that includes men who have sex with men, especially men who have sex with men, gay, bisexual, or other men who have sex with men, who have sex in sex venues, or have sex in groups, or have sex with lots of partners, or have sex with lots of anonymous partners, or have had a bacterial sexually transmitted infection within the last 3 months. And then I did also add to that at the beginning of this outbreak, and I believe LA mentioned this, but at the beginning of this outbreak, we offered vaccination to all of the employees that worked at the local bathhouse, because we knew that the fomites, the towels, the sheets that they may be dealing with on a regular basis could cause transmission or be part of transmission. So I just said that healthcare workers that deal with monkeypox patients and could be dealing with infected towels and sheets and clothing should think about it. Because again, most of the transmission we're seeing is close, intimate contact, maybe even sexually associated, but we have seen other infections, other transmission routes for infections.
Thank you, Dr. Furness. I want to give everyone another minute if folks have questions they want to put in the Q&A, or if they want to throw in the chat, or if you want to raise your hand and come and ask your question live. Sorry, let me just getting a question. Oh, someone asked a question in the chat around the use of public restrooms. Dr. Furness, do you want to talk about if that should be a concern for folks?
So right now, we do not think that hard surfaces in public restrooms can transmit the virus. I would say that if you have the rash, an active rash in places that touch a toilet seat or something like that, that you should probably not be in a public restroom. But we know that the virus stays on surfaces and could be transmitted to other people. We know that soft surfaces like towels and sheets are much better at transmitting that virus in a form that can infect others. We don't think hard surfaces play a big part. That being said, we encourage individuals that have rashes, regardless of where they are, to keep them covered. And if they have lesions or rashes on their hands, we ask them to wear gloves, especially if they're going to be somewhere where there are commonly used surfaces like elevator buttons or doorknobs.
Thank you, Dr. Furness. We do have some folks with their hands up. I am gonna promote them to panelists. If those folks with their hand up wanna come on camera and unmute to ask your question.
Hello, good afternoon, everybody. My name is Alden from Brockton Neighborhood Health Center. So a quick question I had is, I have some patients, male patients, that has gone their first dose of vaccine, but they looking to get their second dose. I believe due to the shortage of vaccine, they cannot get their second dose as for right now. So my question is, when do you guys think it will be available for them to be able to get their second doses?
Where are you? Sorry, I missed that in your introduction. You're on mute, my friend.
Brockton Neighborhood Health Center. I am?
No, you're okay now. And I'm sorry, what city is that?
Brockton.
Okay. So I don't know that I'm going to be able to answer this, because this does vary so significantly from city to city and state to state. But at the national level, there is no shortage of vaccine right now. And we have encouraged every program area that's been offering the vaccine in the past to expand what they are doing, make sure people get their second vaccines, all of that. And one example is that with the clinic that I see patients in here in DC, we were only vaccinating people within the context of post-exposure prophylaxis, or within the context of sexual contacts being identified and epidemiologically linked to cases. So that's the only way they could get vaccinated within our clinic. But as of last Wednesday, we are now vaccinating everybody that wants it. And we are especially trying to do that to get the second vaccines in the arms of those that are most impacted by this outbreak. So I can share my email. I'll put it in Q&A. But if you want to reach out to me about the details, I can try and help you figure this out, because there's a lot of vaccine out there right now, especially with the intradermal dosing. And it should not be a problem getting vaccine, not even the first dose, but it especially shouldn't be a problem getting the second dose. So I appreciate your question.
Yes, please, please, please. And then just to make you, I misunderstood your question. I'm from Massachusetts.
Thank you.
Thank you for that question. We also have another participant. Donna, do you want to go ahead and ask your question?
Sure. Can you hear me?
Yes.
Okay. What I would like to know, that in the time that we're in now with a new virus or a reoccurring virus, monkeypox, is it safe to continue to have restrooms that are for both men and women to share? Or should we not share restrooms between the sexes?
That's a tough question. And I'm going to say that, we do not provide guidance of avoiding public restrooms so I would say that within the context of this outbreak and the fact that we haven't really seen any transmission in public places, I don't think that that's an issue, especially if the rashes or the lesions or the sores, like we're seeing in most of these cases, are covered by clothing and those types of things. But again, we have not done studies looking at virus on toilet seats. We have not done those types of things. So within the context of having the science to back up your question, we don't have that. But when you look at how these infections are being transmitted, it is intimate contact that's occurring over an extended period of time, like minutes, face-to-face contact, cuddling. It is not something that's happening in the air. It's not something that seems to be happening by touching hard surfaces that others may have touched who have had monkeypox. So I can't specifically answer your question, but hopefully that gives you enough information for you to make a decision.
I typically wipe the handles on the faucets before I turn them on, sanitize them before I turn them on. So should we continue? Should I continue to do that?
Donna, I think that's a great carryover from COVID. And it reminds me to say that if you have somebody who has monkeypox and their rash is covered, if they think they have lesions in their mouth, especially, they should be wearing a mask. But if they think they have lesions in their mouth, especially, they should definitely be wearing a mask so that spittle and saliva isn't getting out there to infect other people. And another thing we say about all the cases that go out while they're infectious is good hand hygiene for them as well as others who may come in contact with them. So yes, ma'am, washing off those handles and the doorknobs with sterile wipes or whatnot is a good practice from COVID that should continue until this is over. Thank you.
Thank you.
Thank you for your question, Donna. We have another one from Caitlin in the chat. Any concerns for school and school-aged children?
No. When you talk about colleges and universities, Washington, D.C., we have many major universities here. We're a small city, but we have many major universities and colleges. And we were worried at the end of August, beginning of September, when people were coming back on campus, that this was going to spread out of the well-defined subpopulation that it's currently in. So we were one of the first areas in the country to open up our vaccine clinics to anybody, any gender, anyone who self-identified risk. So, that has not, you have been able to get vaccinated in DC regardless of your gender, regardless of who you have sex with or who you love for a long time now, because we worried about this being spread into sexually active colleges and campuses. We are not worried about this spreading within schools where the students are not sexually active. Again, we have seen a couple cases in children around the country. We had a 6-month-old here in DC. That 6-month-old got monkeypox because his father had monkeypox. And so the father had a really bad case and was infectious before he knew it because he was having symptoms that he thought was COVID or the flu. And the 6-month-old was infected and the wife was infected, and they're all fine right now. So hopefully that answers your question.
Thank you, Dr. Furness. We have another one from Kinley in the chat. How safe for elderly people and newborn babies is it to get the monkeypox vaccine?
So I believe, and I'm pretty sure that the vaccine is approved for adults and children. I don't know what the lower cutoff is, but I know that we vaccinated babies here in DC with a vaccine if they've been exposed. And there have been a couple serious adverse events associated with the vaccine, very few considering the number of the vaccines that have been out there, and they have not been among elderly individuals. They have been about among individuals that were in their 30s and 40s, I believe. So based on what we know, the Jynneos vaccine, the smallpox vaccine, has been approved for the hopeful prevention of monkeypox in adults and children of all ages. We've given it to children here in DC, and I have not seen any adverse outcomes reported among the older individuals.
Thank you, Dr. Furness. I believe that is about all of our questions, and we only have 5 minutes left. I want to give a moment for all of our panelists. If you have anything, a final note you want to leave us with, or any final takeaways for our audience here today. And I'll start with Dr. Furness.
Yeah, I just want to say, because there's a couple questions I'm seeing in the Q&A that popped up. Does monkeypox leave scars on your body after? Yes, we are seeing scarring with monkeypox. It can be just simple pock marks on the face for those whose faces were affected, but there are reports of individuals that were uncircumcised that had enough scarring that they were unable to retract their foreskin, and they needed adult circumcision. So scarring is an issue with these with this monkeypox outbreak, and it depends on where the sores and the lesions were to begin with. So the origins of monkeypox. So the monkeypox, I believe it was in the 1950s. It first appeared in monkeys that were part of the smallpox eradication effort back there. There was a lot of attention and panic focused on it because they thought these monkeys got smallpox. It was related to smallpox, but it was not smallpox, same genus, same family, but different virus. And because it was first identified in monkeys, that's why it's called monkeypox. It's very unfortunate because the animal vector in Africa is not monkeys. It's most likely a large rodent, like the giant pouched rodent, rat, but we don't know that for sure. So unfortunately, the zoonotic reservoir or the animal reservoir in Africa is not monkeys, but it first presented itself in monkeys in the 1950s that were being part of the smallpox eradication effort in a research setting. So persons who engage in non-sex cuddle parties with extended skin-to-skin contact would be at risk and should get vaccinated, yes. So when you talk about some of these events, especially raves or pool parties where people are scantily clad and could be having extended skin-to-skin contact, either hugging or dancing, they should consider that a risk and add that into their equation as to whether or not get vaccinated. So I don't know of any issues. I don't know that kidney issues are a contraindication for dialysis, the vaccine, but I would have to check on that specifically, Aretha.
Yeah, Aurora, I just wanted to reiterate, like all of the different things that we're doing in outreach, is just make it part of your toolkit, make it part of the conversation. It doesn't have to be something, that's necessarily, that there's a crisis. I mean, yes, there could be a crisis for people, but to make it such that it's part of the regular day-to-day work that you're doing as a community health worker in our clinics. It's just another resource that we have available, and we want to make sure to get that information out there.
Thank you, Jill. That's so true. And I will add to that, part of that toolbox should be screening and vaccinations for sexually transmitted infections, testing for HIV, those types of things. A lot of the severe infections we've seen in the country are for folks that are newly diagnosed HIV. They didn't know they had it. They were immunocompromised. Their immune systems weren't working right because of the HIV that they didn't know about. And then they had these serious infections. So just because of the population that's impacted and the way this seems to be spreading, it's a lost opportunity if within the toolbox you don't have screening for sexually transmitted infections and HIV as well. Thank you, Jill.
Thank you so much to Dr. Furness and Jill and Christopher. Did you have one last thing to share?
Just take care of each other.
Thank you, Christopher. We want to give a special thank you to UnidosUS and the CDC team for helping us so much through this webinar and for coming on and presenting. Thank you so much to Jill and Christopher for coming on last minute and sharing their expertise. We really appreciate it. And thank you all for coming and what you are doing in your communities. We know that you will be bringing this back and impacting so much change. So thank you. Please, everyone on the call, take some time today to take care of yourselves, and we hope to see you all again soon. Thank you and have a great evening.